Hi, my name is Lindsay Knorr. I'm a nurse in the cardiothoracic ICU. I'm going to quickly review how to set up a Limmitor Lumbar Drain. The first thing you're going to need to do is grab some supplies, specifically an IV pole, the Limmitor pole mount, drain itself, a single transducer, blue dead ender caps, 2 saline flushes, and make sure you grab a pressure cable and box so that we can transduce it. We're going to get started with the IV pole mount, which looks like this, and this fastens to our dedicated lumbar drain IV pole, just like our Alaris pumps do. Again, we say dedicated just for safety reasons that this should be the only piece of equipment on your actual IV pole. Once this is set up, grab your actual lumbar drain, open up the packaging, and the first thing that you're going to look for is this bracket right here. Take the bracket off, and we are going to set it up onto this square pole mount. It just slides on, and then you secure it with the fastening knob. Once this is secured, grab your actual drain itself, and at the top of the burette you're going to see a little keyhole. This slides onto the sliding bracket and then clicks into place, and once you hear the click, it is locked. Perfect. Now you're going to look for the manifold. This slides in right next to the drain in this portion. Secure it with a knob just like any of our other manifolds, and now this is secure as well. So we have everything secure with the lumbar drain itself. We're going to get started with priming. So go ahead and grab your single transducer setup, and we're going to get rid of all of the extra tubing so that we only have the transducer itself. So in this portion, the only thing that I am interested in is going to be this piece right here. So in order to get started, I'm going to get rid of the actual tubing that would go to a pressure bag, and I'm going to replace it with a sterile flush, just like so. I'm going to get rid of all the extra tubing on the other side after this port, which is what we're going to use to zero it with. And this is going to go into the red dead ender cap right here. Once you have attached this, just like so, we're going to start by priming it down to the patient first. I apologize. We're going to start by priming this, our zeroing port first. So squeeze your wings, prime it to this port. We see a couple of drops. Perfect. Grab your first sterile dead ender cap. And cap it off. Turn it off to this port, and now we will prime to the patient. Turning this stopcock up off towards the burette, we can now prime to the patient, squeezing wings. I'm able to visualize going slowly that there are no air bubbles once we get to the end, making sure that the entire system is primed. To be safe, I'm going to take a second normal saline syringe and replace so that I can now prime up towards the burette. I am turning the stopcock off towards the patient and up towards the burette. Squeezing the wings again, we're priming up towards the burette until I see about 2 to 3 cc's actually fill the burette itself. The reason we do this is to make sure the system is fully primed, as well as to prime towards the drainage bag. So I have a couple of cc's in here, and I'm pretty happy with that. I'm going to leave it off to the patient for right now, and I know that the system is primed. I'm going to unhook my normal saline syringe and put on my last blue dead ender cap, like so. This ensures that there is absolutely no flushes, no pressure bags, nothing attached to the system that could inadvertently flush towards the patient. So when we have the drain set up as such, this will now go slave towards the monitor with a pressure cable. We'll be able to zero our drain and begin either draining CSF or keeping it clamped. Before we hook it up, I'm going to drain the 3 cc's that we've accumulated to the bag just by opening our stopcock here, allowing it to drain towards the bag, and then turning it back up off towards the burette. When we're going to 0, this is now hooked to the monitor and I'm ready to 0. I am turning this stopcock off towards the system, just like my A-line, opening up the first port and zeroing on the monitor. Once the 0 is complete, I'm now ready to turn it back off to the port and address this stopcock, which is the stopcock that will determine whether or not we're actively draining CSF or keeping it clamped. In this current position, with it down, it is off to the patient, which means it is clamped. The two are synonymous. This is going to be your safest position to keep it, if the patient is moving, this is the only way to actually clamp the drain and turn it off towards the patient. If we are ready to actively drain CSF to a set pop-off, we can do that by adjusting the sidearm per the doctor's order in millimeters of mercury on the right side, making sure that our yellow indicator line is leveling up with our pressure line appropriately. In order to open it to drain CSF, we are turning it off to being transduced. You'll see we just deprimed the system, but off to being transduced, and now this will be open to the patient, able to drain up to 20 cc's of CSF at a time. You'll notice that this burette is different than our last lumbar drain system. At the top of the drain is this hydrophobic membrane. It allows the valve inside to essentially float on the drained CSF, and when it reaches 20, it stops the system from draining anymore until you drain the burette. It's important that we don't get this hydrophobic membrane wet, so the system should stay upright unless you have actually drained the burette, and then you can lay it on its side briefly. Once we have drained to the system, there's 20 cc's in here again. The way you're going to drain it to be able to drain 20 cc's more is to turn this stopcock off to the sampling port, allow it to drain into the bag, and then turn it back up off towards the burette. Make sure that this stopcock is always off towards the burette if you're not only draining this portion, as we could inadvertently drain quite a bit of CSF into the bag with an open system. I think we covered just about everything. The patient line is this line right here. This is going to be given to anesthesia to hook up to the actual patient. Make sure that the patient line is secure once it's hooked up. Please be careful because this looks an awful lot like our normal tubing, even though it says CSF access right next to it. And then this is a sampling port that we will not access for anything. This is only for doctor use. You have just set up the Limmitor Lumbar Drain. Make sure that you advocate for the lumbar drain order set to be used whenever this is in use as well. Thank you.